Hi, I'm Dr. Rob Vasquez from Elevation Health, Bedford, Texas. Today I want to personally invite you to the Heart Smart Nutrition Workshop this month. So why is it important for you to come to this workshop? Well, did you know that heart disease is the #1 disease killer in our country? It kills 1 out of every 2 people in our country. Who do you know who has heart disease? Or high blood pressure or high cholesterol? This disease is a silent killer because most people don't even know that they have heart disease. And most people who have a heart attack, they had no symptoms. So who in your family has been affected by this? In our family, my grandfather is the first person. He was healthy as an ox. He didn't have any symptoms. He always said, I don't need to change what I'm doing. I don't need to eat better. I don't need to exercise because I feel great. Well, one day he had a massive heart attack. He never even knew himself to be sick because, again, he felt good. He didn't have any symptoms, yet he was dying on the inside. He had a quadruple bypass, and as a result, he was never the same again. That got him a one-way ticket straight into the medical model. He was put on medications, and ultimately, it was those medications that killed him. See, his plan was that he didn't have a plan. So no plan is your plan. That's why 1 out of 2 people in our country are dying of this disease because they just don't have a plan. And you know that saying, it goes, no plan is a plan to fail. Well, guess what? We have a plan for you. See, a true healthcare plan has to focus on getting you healthy, not waiting until you get sick. And that's what this workshop's about. We're going to give you protocols to help make sure that this terrible disease never happens to you or anyone else you know. At the Heart Smart Nutrition Workshop, you're going to learn the #1 risk factor for heart disease and then how to eliminate it. Did you know that having low cholesterol actually causes heart disease? We're going to show you why that is. Did you also know that diabetes is directly linked to heart disease? And if you're taking insulin for diabetes, you're increasing your risk of heart disease. Also, body weight, that's a significant risk factor. We're going to go over strategies to help you to lose body weight. We're going to go over a diet to help you reduce your risk of heart disease. And do you know also what fats that you should be putting into your body to reduce the heart disease? Well, I know that you've been taught that fat is bad, but fat's actually good for your body. Good fats are good for your body. So we're going to go over 4 changes that everyone should make to eliminate this disease from their body. See, that's simple, only 4 changes. So who do you know that needs to be here? Everyone. So register at the front desk. Seating's limited, so make sure that they know who you're going to be bringing with you. So get your friends registered for this event. They're not going to want to miss out. You're not going to want to miss out on this, and all you have to do is register. So on behalf of Elevation Health, I'm Dr. Rob Vasquez. Have a great day.
High blood pressure can be a pain in the neck. Now some doctors are trying to find out whether a chiropractic adjustment might not only straighten your spine, but also help hypertension.
Health Bay reporter Sylvia Perez here to explain. Sylvia?
Kathy and Ron, many people with high blood pressure would like to find a way to avoid taking medication. A trip to the chiropractor may seem like an unlikely alternative, but an intriguing study is showing that a special kind of neck adjustment is helping some patients lower their blood pressure without drugs. What makes your blood pressure boil? Stress? Too much salt? Lack of exercise? Bad genes? No one's really sure about the cause, but here's something new to consider that might raise the eyebrows of some conventional doctors. Could it be an issue with the top of your spine?
They took x-rays and showed me that my neck was out of alignment.
Denise Neiman went to a specific chiropractor for pain in her neck. After having a special adjustment, that pain was gone, and so was something else.
My blood pressure dropped tremendously.
Other patients were reporting the same positive but surprising side effect. Dr. George Baccaris, the hypertension expert at the University of Chicago Medical Center, decided to find out if there really was some kind of connection.
We designed a double-blind study to really look and see if, in fact, this procedure was affecting blood pressure.
25 patients got the real adjustment, 25 others got a fake adjustment. The result published in the Journal of Human Hypertension found those patients who got the real thing saw their blood pressure drop dramatically, an average of 17 points. That's equivalent to giving patients 2 different blood pressure medications at once.
So it's pretty significant.
Your upper body's off to the left 2 degrees.
So why would straightening the top of the spine affect blood pressure?
It came completely back to center.
Marshall Dickholt Sr. and Jr. say they know why. The father and son chiropractors believe this area of the spine, called the C1 vertebra, or atlas, operates as the fuse box to the body. If it's twisted and out of whack, arteries and nerves at the base of the brain might get compressed, and that could affect blood flow and nerve signals.
It affects your not only your central nervous system, but your autonomic nervous system. That means it can affect every organ of your body.
The technique is used by a small number of chiropractors certified in National Upper Cervical Chiropractic Techniques, known as NUCCA chiropractors. They use x-rays and very precise measurements to determine if someone is misaligned. If so, the atlas is repositioned with gentle maneuvers.
When the spine is misaligned, it can affect all types of things, all types of diseases, conditions.